Good evening, ma'am.
Good evening. How are you doing?
Thanks, ma'am. I'm good. How are you?
All well.
That's
Yeah.
great, ma'am. Ma'am, your name, designation, and your organization's name for the camera, please.
I'm Dr. Indu Bansal Aggarwal. I'm the Group Director and Head of Radiation Oncology Department at Paras Health Gurugram.
Perfect. Okay, so, ma'am, how are you enjoying the event today? How do you feel about
So
it?
I would say that I'm really honored and thrilled to be a part of this fourth edition because I've been associated with BW Healthcare for almost like 4 or 5 years. And every time I look forward to this event because as a clinician, it gives me a different perspective because I'm meeting different CEOs or entrepreneurs or people who have actually established themselves. So it's a great takeaway from me, and every time the topics are different. So today I also moderated a session on role of clinicians in corporate healthcare. How is it changing? So actually it leads me to think of different things other than just the clinical work. So it's always very enjoyable for me.
Thank you,
Yeah.
ma'am. So, I have a very industry based question for you today. Um, what role can public private partnerships play in strengthening medical infrastructure, especially in underserved regions?
So I would say it's a very, very beautiful question. And because I'm a radiation oncologist and my job is mainly technology driven, and I see a lot of gap in between the rural urban areas, and there's a lot of gap between the public and private sector. So as you can see that most of the corporate hospitals or the bigger ones, they have the best of equipment, they have the best of technology, they have a lot of systems in place, and there is a very less waiting time for the patients there. But when you move on to smaller centers or you move on to tier 2, tier 3 cities, or for that matter if you move on to the villages, then even basic things like screening for cancer is not there. And radiation is a very rapidly evolving branch and you need a good infrastructure. So have always felt that a patient is a patient. So every patient, whether rich or poor, they deserve a basic and a good quality healthcare, and we have to save life of every human being. So if the government is not able to provide the basic facilities to the underserved people, then at least there should be some partnership, public-private
With the
partnership,
private, yeah.
so that the same people from the underprivileged
Mhm.
families or
Yes.
underserved communities, they get those services at the corporate hospitals at a much lesser cost, or the people from the corporate hospitals, they move on or they tie up with the government centers and they start providing some basic facilities. And maybe the charges can be little mid segment, uh, so that more and more people can
Hmm.
afford. And so much is happening in the
Also
space of,
maintaining profits.
yes, so much is happening in the space of oncology, and not just in oncology, in all the fields, be it cardiac, be it plastic surgery, be it orthopedics, be it robotic
Hmm.
surgeries, be it
Hmm.
biotechnology. So I think medical field is evolving very, very fast, and we need to integrate public and private partnership so that we are able to reach more and more people and give them the best of services.
Thank you, ma'am. That's so great. Thank you.
Thank you so much.